Good afternoon, everyone. Today we are doing a course of mesotherapy and biorevitalization. And we'll start with the theoretical part. The requirements for a cosmetologist you and I have already studied. This is a neat appearance, medical clothing, cleaned hair, no cosmetics, no pungent odors, working with sterile gloves, wearing a cap. And now let's write down the workplace requirements. Because the workplace requirements of mesotherapy and biorevitalization, they are slightly different. From other procedures. Since these are injectable techniques, there is a lot of emphasis on sterility, so that everything around in your work area, near your workstation, is as sterile as possible. That is, where you can put disposable napkins, on a table, on a shelf, we put them. If you work with a client and used to, well, some masters do so, yes, next to each other in the headboard, on the couch spread their napkin, and there is some cap to put next to each other, so that far away to the table do not reach for the table. Some masters work like this. So it's all thought out in advance. Look in advance where you will have the procedure and prepare for it. Let's get the beauty couch. How is it different from a massage couch? The fact that the beauty couch is divided into 3 zones. And the top half can be curved, the bottom half can be lowered to make the person assume a sitting position. This is important during facial injection techniques because sometimes we need to look at the person to see how they will look. That is, when one body lies down, when another body sits down. We will look at both lying down and sitting up so the beauty couch is adjustable. Next is the beautician's chair. You and I have written in the last course. Areas for the client to dress up, a coat rack, a chair so they can leave their stuff. Jewelry wear, so he can take it off. A beautician's table where everything you need is laid out for you. Shelves. So here we go on the consumables. Consumables. Disposable sheet, disposable cap. Cosmetic wipes, cosmetic. Just as with the facial massage on the course we recorded. This is where I would also advise taking a small size and getting a large. With the same goals of working on the client's skin with small ones instead of cotton pads. We work, protect our clothes, or put large napkins on a shelf somewhere. Disposable hats. On yourself and on the client. Carhexidine to treat hands, for example, 1 more time before the procedure. We'll need syringes for the mesotherapy. I'll even be showing you now. These are the syringes. 5 milliliters. Okay, next up are the mesotherapy products themselves. We'll go over the drugs a little later, we'll study them separately. Disposable needles. For mesotherapy, you can immediately know whether it is 27G or 30G. Here's what the back says. Some people use, here's the difference, for example, the needle length is 13 millimeters or 5 millimeters. Some 5 millimeters is used for the head. There's a special technique of injecting a mesotherapy cocktail into the scalp. Then 5 millimeters can be used. For all other cases, across the face, across the body, into the fat deposits. Also the head can be used in 13 millimeters. Gloves. We won't do the procedure without gloves. This is unacceptable. Gloves are mandatory. Chlorhexidine on the record. Anesthesia's next. We'll figure out which anesthesia is best, too. But she has to be. And the film. You can use food grade, you can use specialty. In order for this anesthesia to shut us down. Contraindications to mesotherapy and biorevitalization procedures. Let's get a few of them down. For example, heart failure, high blood pressure, low blood pressure. Blood disorder, thyroid disease. Myocardial infarction, microinfarcts, diabetes mellitus, gastrointestinal diseases, hepatitis A, B, C. Tuberculosis, venereal disease, epileptic seizures. Well, I mean, these are such clear contraindications that, well, I think any normal person will hear when such words will not perform the procedure. Well, the most important thing, this is of course, and the most common, is allergic reactions. Allergic reactions, pregnancy. Drug intoxication. There are women who get and can go in for the procedure so it doesn't hurt. So keep that in mind. In pregnancy, it is clear that we will not do under any circumstances, right? To rule out the possibility of preterm labor. Allergic reactions. Here is a mixture of therapies, even though it is considered a simpler procedure than biorevitalization, but it is here you need to be careful that allergic reactions more spectrum, because there is a huge number of different compositions. There may be vitamins and various natural components. So here, when we do mesotherapy, be more careful than with biorevitalization for allergic reactions. So, again, if a person has an allergic reaction to something, we second question should definitely ask how it manifests itself. If he is swelling and being taken out in an ambulance, we certainly won't work with such people. We don't want any accidents. That's why the allergies. In mesotherapy also, if it is necessary to make a test for an allergic reaction, a person does not know, maybe yes, maybe no, maybe doubts, worries, a test is made here in the active fold on the side. A papillary injection of the drug is administered. And time is given. But if you have, for example, a cocktail is in such a flask ampule, and you open it in order to taste it, it is very unprofitable to wait for it to spoil. And it's not like the customer is going to pay him because he wasn't made. So from that point of view, of course, it's not very profitable to do these samples. Well, for your own safety. If you doubt it very much, you can. How many dresses do you need? Well, different masters have different ways. Some people just let them go for the day. Come right in, see you tomorrow. And someone waits there for 15 to 20 minutes if everything is normal. There is no itching, redness, or any rashes. The man is feeling good. So they do. It is mandatory during injection procedures are questioned regular how you feel. So we look to keep the person conscious. Especially when we shut up, eyes closed, there's bound to be a how. Is everything okay? So be sure how you feel, so that you do not feel dizzy, so that there are no ailments. If any of these things happen all of a sudden, or severe redness, it's not. Then we'll end the procedure immediately. It is desirable that you have some antihistamine, suprastincic, and watch the condition. Observe that the person does not feel bad. If it gets worse, we call an ambulance very quickly. So what I'm saying is, there's never been any such cases. Still, the manufacturers of mesotherapy, biorevitalization, the manufacturers of these drugs, it's more commercial than helping people. Therefore, it is to no one's advantage to have such cases. They are minimized as much as possible. As a rule, all preparations are hypoallergenic. Hyaluronic acid, but I don't know who's allergic to it because it's produced inside of us. So as much as especially don't relax, always be on the tip, but keep in mind that in principle such cases are very, 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 very rare. Next, an initial consultation on how we're going to fit. The important point here is whether or not the person has been somewhere before for such procedures or not. So if he was, he probably knows better than you do what he needs. What she wants, where to inject, how much to inject, she'll tell you. If this is the person's first time with such a procedure, yes, remember, you and I have taught facial massages super techniques that really get results from the course. It is desirable, of course, to see, and if there is a possibility of such, then first we do a course of massages on the face to eliminate fine lines, tighten the skin, remove the second chin. The best way to do this is with a massage rather than injecting lipolytics. First it is remove best quality massage, then, if suddenly something remains, you can do lipolytics and work on the face. Another conversation, you can combine a course of massages with injections. That is, let's say we do massages every other day, injections once a week, biorevitalization once every 2 weeks. That is, theoretically it can all be combined and combined. In the initial consultation, as with any service, we need to understand what the person wants. As she came in, I wanted to say, for a lip augmentation. That's how it is with us. As she comes in and says, well, do something for me. Well, I want to, but I read that it's going to be good. I mean such general words. Of course, we as cosmetologists who make money by doing these procedures, yes. Something we can do easily. We can give you a vitamin shot and let you go. But I always teach to do favors for people and see if she really needs it. If she doesn't want it, my reputation is worth more to me. And I'll say, let's do this, we're going to do some grooming treatments with you. If suddenly you keep insisting on injectable techniques, we'll see, we'll do it. Here you go. Next, skin structure. We have already sketched the structure of the skin. And again. Once again, let's see what skin structure has to do with our procedures. So what do we call the top layer? Epidermis. Next, where do we have blood vessels, sebaceous glands? What's that called? Derma. And lower at our place. Subcutaneous fatty tissue, then the muscles of the bone. That's right. Let's sketch what our wrinkles look like. Upper epidermis. Subcutaneous fatty dermis. That's how healthy flatulence is. Next, do we have fine lines and wrinkles? These are usually the first signs of an invasion. They look like this. We'll be the ones with the deep wrinkles. We'll be the ones with the creases. Between shallow and deep still among the on, and there we sow. For the sake of clarity of the example we will omit, because, in principle, not so important. I'll start with the fine lines. What kind of things could they be? Well, the mimic ones are the most. Around the eyes. What are the deep ones going to be then? I mean, they're already more. Let's crease. Creases. There's a nasolabial fold. Oh. The masters are working. Nasolabial. It's a hall. There's a clear tissue breakage. The deep ones are mimicry. The mimics we get on. On the forehead, around the eyes. Around the eyes. On the cheeks of many who smile. And small. And small. When? They're just fine lines. They can be on any area of the skin, just because the skin dries out. And so that's what skin laxity is, like fine lines, that is on any area of the skin can be. For example, just so you're clear, some aged women have unpleasant skin in the décolletage area where the breasts meet in the middle, and it's the same on the face, on any part of the face. So, watch this. Epicellomas are a contouring course. And healthy skin that needs to be nourished, moisturized, and fine lines and wrinkles we have this. Mesotherapy and biorevitalization. We will inject the drug. If we work, for example, biorevitalization, inject hyaluronic acid, we will try to inject here. If we see this fine wrinkle, we will try to inject at a 45-degree angle, right under it, so that we can inject the drug to smooth it out. Here we fill the area with hyaluronic acid. And it's leveling off like this. That is, with the help of biorevitalization, you can smooth out fine lines and wrinkles for a long period of time. For the long term, due to the fact that we have hyaluronic acid from biorevitalizant preparations will begin to synthesize on its own. That is, to be produced in our bodies. First we bring it in here and then the synthesis begins. This makes the result last for 6 to 8 months. The same is true for contouring. Basically, yes, the principle is the same. That is, here the wrinkles will be a little deeper, but the drug will be injected in the same way, but of a different consistency and injected into this area. Exactly the same. And that's where it's going to be more, it's denser, just like that it evens it all out. Indications for mesotherapy. What do you think are the indications for mesotherapy? Well, these are some individual, naturally, complaints about fine lines and wrinkles. No. Let's start writing the sign with you now. Because the first point, knowing this point, we will be able to talk to you in the same language, so that you understand the difference very clearly between mesotherapy, biorevitalization and contouring. So we make a new table and write it down separately. Mesotherapy. We write numbers like this. These are the numbers that stand for the molecular density of hyaluronic acid. Let's write everything because it's clear and obvious, right? But we'll write nonetheless. Hyaluronic acid. That's it. Same hyaluronic acid, but of different molecular densities. And procedures are already called by different names. So it's like water in here. Six to 16, yes, a very fluid liquid. Here is a gel, so weak. And in contouring, it's a thick gel. So the difference in density. Accordingly, if we have a small wrinkle, and we inject this liquid into it, this wrinkle, well, injected, well done. She doesn't care. This fluid is excreted after 2 weeks completely. In order to correct fine lines and wrinkles, these, yes, creases, you need to inject gel. Either biorevitalizant or contouring. If we inject a biorevitalizant, you see, it's weak, right? It'll smooth out the fine lines. Around the eyes, if you take more, there are different preparations. If you have 16, it's very light, you can spread it all over your face. But the thicker the gel, the more locally we will apply it. If we have a weak biorevitalizant, we can put a good moisturizer on the whole face, small wrinkles can be smoothed out. But, for example, with a density of 26 to 28, we can already see that it can be contouring even somewhere, for example, around the eyes. Biorevitalizant 20 to 28 if it has density. It may also be called contouring to fill in deep expression lines around the eyes. So you have to always be careful here, looking at what you want to achieve. The fine lines are right here. And deep wrinkles, creases, nasolabial fold, volume increase is our contour plastic surgery. Now we're going to put it all in the same spreadsheet and keep writing. The criterion by which we will compare mesotherapy, biorevitalization, and contouring is indication. Indications. You can sometime there the indications for mesotherapy are vascular asterisks. There are vasoconstrictor cocktails that we inject into the locations of the vascular asterisks, and thereby help shrink them. Feels. It's not a healthy complexion, it's a vitaminosis. Age spots. But age spots, it certainly takes a lot of effort for mesotherapy to help. There are actually such mesotherapy drugs for age spots. But I haven't seen any successful cases, yes, that they've cleaned up, yet. So they can make them a little less noticeable, right? But still. Mesotherapy, isn't it? And I wouldn't go too hard on the vascular asterisks either. I mean, frankly, we're like coworkers now, right? And frankly, there are treatments for vascular asterisks. There's money charged for that. There's products that cosmetologists buy, that clients buy, right? But frankly, it doesn't help much. Because mesotherapy, it's in and out. That is, either it needs to be very long, or a lot, or a lucky coincidence that all the stars aligned, then maybe it will help. But that's being frank. But still we do. If there's a need, we do. We have mesotherapy. Remember, it goes into the face, hair, and body. Face, hair, and body. So the longest column on indications would be in mesotherapy. We're the ones who recorded the facial readings. Scalp indications. In the same mesotherapy column, we write for the scalp, heads. So it's alopecia in men, like when baldness appears. We experimented with alopecia on a boy once. There was a gap in his beard. We gave him mesotherapy. Thinks the hair will start to grow there. There may be something, but clearly there is no such growth. But this procedure is also done in clinics. Mesotherapy against hair loss strengthens. If the vitamins are taken out, I'll tell you right away, I may forget that mesotropia is an injection, it's done with a needle. Acupuncture itself is a stimulation. And it happens that the drug itself is injected and withdrawn, but it is the stimulation that can affect the fact that the hair will begin to grow well. Just like a head massage. I tell you the pros and cons at once, so that you as a specialist can understand. We didn't really believe in miracles, that anything could happen. But if it were that simple, long ago all people would have been happy. If they just shoot themselves in all the places, there'd be no problem. For thicker hair, to improve hair growth, to improve the condition, quality of hair is done. Due to being excreted in vitamin complexes. Next, for the body. For the body, we have mesotherapy indications where we do the most common lipolytics for fat reduction. That is, we will inject fatty lipolytics into the fold to reduce adipose tissue. On the body also we work as we do lymphatic drainage. So there are lymphatic drainage cocktails. Against vascular stars on the legs, for example, against varicose veins also on the legs. Will be, Here we have a wreath, for example. We will be introducing. But we'll come back to that a little later. And we inject these same lipolytics into the second chin area. So again, it's back to the face. Typically, we have vitamin C to strengthen blood vessels. Entering. Indications for biorevitalization. These are the first signs of aging. Dry skin. Fine lines. "16-year-old, 18-year-old, 22-year-old girls do not need to have biorevitalization. After 25, it starts. And then there's the contouring. We have the testimony. These are deep, medium, deep wrinkles. Mimic wrinkles. So we're going to have contouring, yes, filling in the nasolabial folds. That is, the indication is pronounced nasolabial folds. Mimic wrinkles around the hound's foot eyes. Deep expression lines on the forehead, interbrow. And lack of lip volume. I say that because contouring was originally invented, of course, for lack of lip volume. But now we all see girls with normal lips coming in to have them enlarged. So, I'll tell you right off the bat, 1 syringe will increase, but without. No special effects. If we see some funny commercials and pictures on the internet where a woman with such lips, it is clear that it is not 1 syringe, and not 2, and not 3. That's where those syringes are done 2 at a time, and after 2 weeks, a month. That's a lot. I hope we never get to that point with you. God grant us fewer clients like this. Now we'll finish this plaque, and I'll let you go. Course, procedures. That's the next criterion by which we're going to compare these 3. Course of treatment. Mesotherapy is usually done once a week. Anything in the face, in the body, in the hair is done once a week. The course of 5 to 6 is a minimum of sessions. Ideally it is, of course, 10. After 10, it's mandatory to take a break. Biorevitalization is done every 2 weeks, and the course takes 4 to 6 sessions on average. Every 2 weeks, 4 to 6 sessions of the case. That's an average. There are girls who can be done 2 or 3 times. I mean more or less some mild cases. And their age customers. For example, my grandmother is 70 years old and has never had anything done to herself. It's understandable, 6 sessions isn't going to be enough. You should have done more. Well, and contouring is done. What's the maximum you've been taking? 7 to 8 at the most. And to start, here's if instead of therapy there's about just different cocktail formulations. But in biorevitalization the preparations mainly differ just by density. 16, 18. And you should always start with the youngest. This is for the average, for women. If a grandmother of 70 years old came to us, it makes no sense to start with 16 in principle. I mean, we'll take something bigger, thicker. The strongest one doesn't need to be done right away, even if it's really bad. The strongest one is never done first. It should definitely be done next, in order for him to consolidate the result and reinforce. All the more reason to consider the addictive factor. That is, a person gets used to it. If you enter their 16, 16, 16, 16, 16, yes, your skin is already used to it. To enhance the effect, well, if you suddenly don't get enough of what it gives, then take more. If the effect is enough, we stop. Because a man doesn't get younger, he only matures over the years, yes. And if you give him 28 right away, what's going to happen there? What's he going to do next? Next thing you know. It's okay if you're used to it. Here you go. And contouring. It's a one-time procedure. Since the result, the drug manufacturers promise us, lasts for 6, 8, 12, 18 months. Somebody even. Accordingly, the procedure is done on an as-needed basis. That is, once the effect is lost on who has how differently. That's how we do it. As needed. Yes, by necessity. And we take the amount of the drug as needed, too. Depends on how many zones, what zones we're going to work with. Quantity of preparations according to the area added. Yes, for example, let's note right off the bat that if we take mesotherapy, let's put the amount of drugs in the next paragraph. The number of drugs in one session. If we take mesotherapy, for example, for the face and décolletage area, 1.5 to 2 milliliters will be enough for us. That is, it is disadvantageous to take Ampal 5. You won't be able to face it all. You'll just have to throw the drug away. But they are actually cheap, so you throw away 150 rubles, and the procedure costs 2,000 there. So we take as much as we need. But we inject about 1.5 to 2 milliliters per session. Next in biorevitalization is usually the pre-made ones. Already prepared preparations, yes, here they come. And with the example of Isle and Rich's princesses, we'll see what's available. Isle, for example, 0.6. It's 0.6, it's even less than 1, yes. There's 0.6, and there's 1.1. So, if we start working with a client, such a normal young client, we take 0.6 at first. Or we only have, let's say, the area around the eyes. Or just some kind of slit in there. If there's one area the client is young, we take 0.6 volume. If it's a lot of work, you want to go all over your face, neck, décolletage, then we'll take 1.1. In any case, if possible, start with a small amount of the drug. And with subsequent sessions, we can increase the volume to 1.1. Princess Rich, for example, there's a 1.0, 1.1 going on there too. Right off the bat, yeah, there's no such 0.6 selection there. And in other firms, in principle, also about 1 milliliter goes for one treatment. At most, I'd say 2 per session. You can get 2 syringes. If your aunt really needs it, you can get 2 of 1.1, 2 of 1. That is 2 milliliters. The same goes for contraplastics. The same goes for contraplastics, means we have syringes usually 11 minutes 10, and this is usually enough to work well on one area. For example, 1 syringe will suffice to increase the cube. If we want to make it bigger so everyone notices, we take 2 syringes. But 2 syringes, of course, if you're a reasonable person, please don't do it in the first session. Make 1 if you really want one, have it later, 2 weeks later come back and we'll make a second one. If you really have to. 1 is enough for the lips, 1 is enough for the nasolabial lips, if they are very pronounced, to introduce enough quantity there. 1 preparation is also enough for wrinkles. It happens that we take 1 and, let's say, fill 1 or 2 wrinkles on the forehead. Here we introduce some path in the hound's feet. You can distribute 1 syringe over several areas, but if the problem is minor, that's understandable. Results from 1 session. Next criterion. If we're talking about mesotherapy, like remember who we were with yesterday or when it was, it's better to go than not to go, right? Same with mesotherapy. See, what a winged phrase, it stuck with me, this is the 3rd time I've used it. Same thing with mesotherapy. Better to do than not to do, right? But we're not likely to see any obvious wow effect, are we? The placebo effect has a place. Oh, how do you do that? Well, things happen. A person can look at himself today, not like himself, look at himself tomorrow, not like himself. And so it's not always up to you. But mesotherapy, I told you, takes it completely out of your system in 2 weeks. And basically, well, to refresh the complexion, yes. Somehow do something to her that's so noticeable. Hardly vitamins to administer to soothe the soul that you have in your face vitamins. But you can, too. That is the result of 1 session, it is rarely visible to others. More often for the man himself, if he really wants it. The result immediately. Here let us have the first criterion, the result from 1 session, and immediately we will write the result, the next criterion from the course. Course result. No, it's this. And if we talk about the course, as we have already said, once a week, 5 to 6 sessions, then we can see some clear improvements, in principle, for others. The complexion improves. Well, that's the kind of person who gets chipper. Well, if he walks through life with a droopy face, nothing will help him, of course. He has no therapy, nothing, basically. But if let's say we're talking about reducing the second chin, yes, there will be a reduction. About vascular asterisks 50%, there is a 50% chance that in 50% of people they can shrink. It'll be a little smaller. Next up is the next biorevitalization. The results from 1 treatment, yes, you can see it, because it's a thicker gel. And she really after 3 to 4 days can already observe the first ones. That is, the skin is smooth in the areas where the drug is injected, fine lines are smooth, and the skin is moisturized. From one session there are results. From the course we eliminate fine lines and wrinkles. So it's really from a course of Porter to take away fine lines and wrinkles. The deep ones shrink, but the deep ones don't. Let's go medium. Medium wrinkles are reduced, slightly less noticeable wrinkles become a little less noticeable. And there's a long-lasting moisturization of the skin. That is, the hyaluronic acid that we injected and that is subsequently produced with our body. It helps to moisturize the skin long-term. So for whom the word hydration is very important to clients, biorevitalization course. Especially in the winter, for example, it starts to dry out. It's a must. And, accordingly, this rejuvenating effect of the course is achieved, that a person is really rejuvenated, due to the fact that the skin is smooth and saturated with moisture, becomes so glowing, healthy. For example, yes, as a cosmetologist, when people ask me what is better, meso-biorevitalization, I would not do meso at all, yes, because I really doubt very much in the funds spent and in the results from them. But biorevitalization, then really what makes sense to do so you don't have to spend money on a sub-deadline mesotherapy. And the result of contraplastic surgery from one session is visible immediately. That is, medium deep wrinkles are filled, the nasolabial fold is equalized, and volume is increased. And where you need it, like cheekbones, lips. That's because we recorded it. Do you have any questions? I see, right. Let us then take note of what mesotherapy is all about. You think after everything we've recorded with you. Vitamin cocktail. Yes. Well, let's write it down. Mesotherapy vitamin cocktails. Which are injected. In the sod. In order to improve skin quality, vitaminize, and reduce vascular asterisks. Improve hair growth. Let's put it in parentheses on the head. On the face of it, you can think about it, too. And remove excess fat deposits in the brackets on the body and second chin area. And we'll have that in brackets on the body and in the second chin lipolytics area. Can I count lipolytics injections for the second chin with an anti-second chin massage? You can, you should. It's the perfect complement. I'd even say just injecting lipolytic like that. Certainly effective because the area is small enough. But it's still better to massage to break up the fat fold, to disperse all the blood to rush there. And then immediately after the massage, inject Repolitic. And then, of course, such a cocktail will work very actively there, spread and split fat deposits. Biorevitalization. What's that? And injectable administration of hyaluronic acid-based preparations. We write the density here right away. And by the way, we kind of sketched that out, but didn't say it out loud. It's all hyaluronic acid. This is where we talk about vitamins all the time, right? But there's a mesotherapy drug in here, too. Hyaluronic acid is called hyaluronic acid because it's liquid. It too can be injected for the alleged purpose of moisturizing the skin. But it's clear that we're unlikely to get obvious moisturization here. But you can. That's why hyaluronic acid is so clean. It's in mesotherapy, like water. She's a biorevitalizer. It's a thick gel. And the contouring is like a thick gel. Bends to create volume. That's why we have biorevitalization as this introduction. Based on hyaluronic acid with molecular density for the purpose of long-term skin moisturizing, smoothing fine lines and wrinkles. Contouring. Here the preparations are called not just preparations, but fillers. Contouring. Introduction of fillers in brackets. Hyaluronic acid-based preparations density and write the density. Into obvious cosmetic defects on the skin, medium deep wrinkles. Insufficient lip volume, nasolabial folds, lip embodiment, lips, thank you. Yum, yum, yum. Relax. This needs to be put on the face to absorb the effect itself. It's in the carotid artery. Well, she's got a lot of energy, I'll give you that. Near the carotid artery. All right, put it down. Little snakes. Look, it's not that scary yet. Maybe she's not crawling yet. Of all the kinds of apples, she likes eyeballs the best. She liked your nose. Look at that. Can I breathe? Unwanted. The door has her head now. Where's the hair? She's got her head in the door right now. I hope she thinks I'm a rock. Well, I don't think so. She said it. That's a shot, listen. Oh, Tanya, yes. Well, can I put it in my mouth? Well, no. She accepts. It's okay, she's deaf. Deaf. So you can only sign language with her, right? Unfortunately. Yes. On vibration fields. She's about to crawl into the cleavage area. What do you think? God, I've overdone it. Tough, almost popped my heart out. In this part of our lesson, we will go through the scheme of drug administration and understand the preparations, which are for mesotherapy, for biorevitalization, and for contraplastic surgery. Drug administration scheme. Insertion techniques. The first, most common, and the main one we will be working with is the papillary injection. Papillary technique, papillary injection. This is our skin epidermis dermis. Let's imagine we have either fine lines, creases, or deep wrinkles. We'll use a 45-degree papillary technique to inject into the dermis at a 45-degree angle, preferably in the area where it is needed in biorevitalization and in topical therapy. Contouring plastic surgery is accordingly such an injection downwards, just under the wrinkle. So right under the wrinkle, no matter how deep the crease is, it's injected right under it. If it's small or medium, match it accordingly. That's where we have the wrinkle. It will be easy to put this into practice. That is now sketched schematically in a side view. It is clear that when we make the cut from the side, we will not see in any way, we will rely on our feelings. How deep the wrinkle is, that's how we inject underneath it. At a 45-degree angle. So we're administering the drug. We inserted the needle. If it's a wrinkle, under the wrinkle into the dermis. If it's just to distribute the drug evenly over all areas, we insert a needle into the area of the skin where we started. Usually, if we have that. Mesotherapy and biorevitalization at an angle of even 45-30, 30 degrees even we inject, yes, lower. And the insertion depth will be somewhere around 5 millimeters. So we insert the needle 5 millimeters under the skin. 5 millimeters. These are mesotherapy and biorevitalization. If we're talking about contouring, we have bigger problems there, bigger creases, deeper wrinkles. And that's where we're going to insert the needle, a little bit longer there. To inject the drug, accordingly, we inject the entire length of the needle. That is, if we have the task of filling the nasolabial fold, we find the beginning of the nasolabial fold and inject the drug. Wrinkles under for the full length of the needle inserted needle further pressure on the syringe plunger, and inject the drug. Mesotherapy and biorevitalization will give us, most likely, on the skin like this, puffy pimples. Papules form in the areas where we inject the drug. They're papules. And the technique is appropriately called papular. Second, napash. Napash we'll be using. There's a head here, too, right? It's going to be exactly the same. We will use napash for the head as well, only it will be a different technique. Remember I told you 5 millimeters, which is the needle, right? For the head, we can use. Here's the case in point. Now we're just getting to that point. So, for the head and for the fat deposits. For the head, a 5 millimeters needle. In fact, other than stimulation at the expense of the There is nothing particularly useful about this technique. Well, it's clear that, here's an idea. Napash is when we enter perpendicularly like this, going over the head, for example. And here are some masters on the internet, for example. You can often see some such clips. Well, they directly all over the head like this, all this inject the drug. It's clear that there's a minimal amount getting in there at all, and that's it, the whole drug, it's poured on your head. Yeah. Same thing as a mesrotter. That is, it all kind of happens from above, and due to the stimulation from the needles, yes, it can happen. For fat deposits, this is we take the fat fold, belly, thighs, front, there, back, flanks, second chin. Here we've got the fat fold. Directly right that it takes a fat fold. At most, as far as you can capture it. And injected perpendicularly. 90 degrees. Aha. There's nothing complicated about it. Well, I'm just showing you. I had one boy who worked like that. Someone taught him. Yeah, the syringe is holding up as usual. That's how it is, right? Grasp the crease and inject the drug. We put the needle in, then we press the strip. Pressure has been stopped. And only after that do we output. So it's not like you're still pushing, but you're already pulling out. So the drug doesn't come back out. So we took the crease, put it in, put pressure in, took the pressure out, took it out. So that the drug comes back out at a very minimum. There are times when a lot of drug comes out, like a dew of drug on the injection area. Well, here you look. Either you inject so, not very carefully, yes, that you have drugs come out, or it is too liquid, or some needle leaks syringe that it leaks. Next. Well, goodbye. What do you have to offer? I just. A piece of your body. We'll keep that in mind. The right technique. So in biorevitalization, in mesotherapy. The right technique. Well, it is difficult to imagine how it can be used there. The correct technique is usually fill some volume is used in contraplastics. How it happens correct technique. Here we have a place of steak, and for example, nasolabial fold place in the steak, we inject the drug. We remember that we have a longer needle for contouring than for biorevitalization or mesotherapy. And this needle is inserted through the injection site next to the wrinkle. Then under the very wrinkle. And you know how, here we go. We push the piston, and on the way back we push. The gel is spreadable. About a couple millimeters before the point, we stop the pressure so it wouldn't come out. The gel is out. Stop the pressure, got the needle out. Then we turn it around and lead the same way. Completely needle pointed. Start pressure on the piston, spreading the gel. In 2 millimeters we stop the pressure, needle up, turn around and do the same thing again. So we have one injection site, but we have as many as 3 tracks under the skin. What are the cases here? The nasolabial is not just a crease, a single track, not just a crease. And when there's an obvious failure in this area, like in older women, that's a clear failure. You make one track in there and nothing will come of it. It needs to fill the entire area. And this is the kind of machinery that fills the whole area. Next, we'll do the next injection right here. And we'll do the same thing. The next one's here. That is, it's a technique for filling volumes. Some people use it on their lips, but it's quite traumatic on the lips. There could be a lot of syncope, burst vessels. So I would recommend doing it on the dip in the nasolabial fold. The following is a linear introduction. Accordingly, it can be, there it is, that's our nasolabial fold, right? It refers to contouring, where we take a wrinkle, here we have the injection site. We pulled out, 2 millimeters needle, further the injection site, injected, pulled back, the drug is put there. Remains and for 2 millimeters we pull out, and this is how we fill all this stuff naturally, that is, this ruler, linear, you can do everything with it. It can remove wrinkles on the forehead, nasolabial lips. That's exactly the same way goosebumps go away, yeah. And lip augmentation with basically the same technique. I mean, there's some, you know. It is clear that there may be many more techniques in the world, but what I give is basic, and it is acceptable to everyone and always. If something there is to be sophisticated, I have seen the perversions that can be used to increase the lips, but you can show off in front of colleagues, in front of clients, to pay, for example, money for advanced training to teach you how to do it somehow perverted, but there is no sense in it. So with these techniques you can do whatever you need to do. If you want to get something out there, you can go to someone to teach you, someone, something. I'm all for simplicity. I mean, why make it up and do a lot of injections just to make you seem somehow cooler out there? If you can do the same thing but with minimal tissue damage. Consequently, here it is the nasolabial fold and all the wrinkles on the forehead. We have wrinkles around our eye. They're filled with this one. Next, with the nasolabial fold, what else can be done? Stitch it. That's the nasolabial fold we have. But the stitching, I would say it's like a fixation. Linear technique is an alternative to fan technique. Just write it down. How does fixing the result from a linear technique? Or as an alternative to the fan technique? I don't think you'll need to do that on your forehead. Around the eyes, too. Again, it's possible to fiddle with the nasolabial fold like that. So, what's going on? We produce linear as usual. Next, if we have a severe lack of volume, we'll stitch it in lieu of an injection. That way, that needle you'll get so far. That is, watch the length of the needle, determine where half, yes, and half you should have a wrinkle. So you have to work the wrinkle all the way through. Next, you indent about 1 millimeter or so. And enter from the other side. Exactly the same. The method of administration is the same. We insert the needle, we start to press the piston, the gel comes out, and for 2 millimeters we stop. We take the needle out, so that the gel does not flow out. Continue like this, and the entire length of the wrinkle. Why is it important to take steps in different directions? Well, imagine we start doing everything one way. By the way, some masters do that. So we're still, you see, 2 millimeters short here when we take it out, and there might be more here because we're starting to put pressure on it. We can inject a little more of the drug at the beginning of the pressure. And then we'll have this whole area bigger than this one. You'll create asymmetry. To prevent this from happening, do everything evenly. To then spread this gel inside, so that it's all smooth, nothing to mess with. So, what depth, where, what layer to get into, yeah, that's all going to come literally with the first, second client. You'll understand, and you'll automatically get it all right. It's hard to get in the wrong place. For example, into a fat deposit, yes, into the body. Other than fat deposits, lipolytics are not injected into any areas. So fear not, you have captured the fat, there will be nothing there but fat. That's where you inject the drug. If, for example, the papillary technique, there are veins, vessels on the face, for example, wand. But these papules, they're gonna be like this, they're gonna be in rows and rows and rows. You will learn to go under the epidermis very quickly, and you will be able to do it to any person anytime, anywhere, even with your eyes closed. So you just have to figure out where to go in the first few times, and that's it. And then you'll forget about it. You won't have any questions about it at all. Therefore, okay, it takes practice. But in theory, I get the theory. Good. Then let's focus on the lips. Again, there are a huge number of schemes out there for lip augmentation. And those manufacturers of lip augmentation products, they have an interest in having the masters buy from them. So they come up with all sorts of things. I've seen the perversions before. So let's go with the classics. You're going to learn how to make a classic today. But I will show you can correct asymmetry, you can raise the corners of the lips, you can increase the total volume, you can just make them to be moisturized. You can do so that the upper contour line to not have this bend, can conversely strengthen this bend lips. Angelina Jolie show how to do in principle, it is enough. All customer wishes will be taken into account. So with lip contouring, what are some of the key points? Let's spread the lips halfway down like this. That's the inner, that is what goes into the mouth. We have half of the upper lip, half of the lower lip. So we'll agree right off the bat that we're not going to do it here. Nothing. It's very soft tissue, there's a lot of veins there, and there's no point there. Because if a drug is injected in there, it's going to look kind of scary. So that's an area internally we don't do. We do only the top half and the bottom half at once. Classic lip augmentation. This is when we have a 1 milliliter drug, which is a full syringe. Use on the entire surface of the lips. So our goal is to enhance the lips as much as we can. And with this 1 milliliter, we work on all the lips. Write this down. Find the corner of the mouth, indent 5 millimeters and inject the drug. Linearly inserted the needle, start to press, stop at 2 millimeters, pull out. Further into this place where we ran out, we enter again. Look, since you are a beginner, the drug is expensive most of the time, and in order to correct some of your mistake, you will have to do it out of your own pocket. So the client is not ready to taste your mistakes. So to make sure there are no mistakes, do everything symmetrically. So that you don't do one side and then all of a sudden you run out of the drug. This is gonna be fun. So you be on your guard. It's very important here that the drug is limited. It should be injected symmetrically. Let's put it this way, as you are a beginner. Let's do the same thing on one side, then do the same thing on the other side. Then one side, one side, one side, one side, one side. It's understandable when you have. The eye is trained, the hand is trained. You've already done it 138 times there. You can from one position enlarge all of your lips. But for now, we're starting so that you understand roughly the distribution of who gets how much medication, so that you'll be okay. So then we do the same thing on the other side. Also 5 millimeters off. And just like that, we go linearly along the contour. Now we're going to go over the contour of the lips. Further, it happens often that here not the whole needle will go away, but half, that is, to the top. Here we insert the needle not completely, so that it does not go all the way to here, but how much is left to the top point. There you go. Here we are at the top. When we get to the top points, we need to know what we want. Either go with the natural form. Natural. So we're going to go downtown from here. There's an option. If our task is to make the line even, well, all kinds of fashion happens. Now it's fashionable, all kinds of lips, and if a girl wants to make even lips, then we will go from this center to this center like this. There's basically one needle to grasp. If it's not enough, then a few do. From the top ones, make an even line. It's to level it out. So that's what we're emphasizing. Emphasize naturalness. That's what we're leveling. And if our goal is to lift the corners, remember, yes, the starting position is at this point. When we get to the top, we decide either we go downhill from here or we go flat. But if the goal is to emphasize this bow here, yes, we're going to indent 5 millimeters up from here. And the injection will start right here on the top of the lip, 5 millimeters away from the lip. We're the ones with the lift too. Lift. So we're going to insert the needle here and guide it to the center. Then it puts pressure on the piston. It presses, it presses, it presses. And we're watching. This is where the drug is injected to. And stops in 2 millimeters. That is, you inject the gel above your lips. Above the level of your lips. Further, to emphasize this point. Our bows. With kneading, the second part will be contouring, this kneading. When kneading, take into account that your task is to lift, and just with a finger we will lift all this matter, fix it. Good. We walked along the upper contour, right? Seems pretty clear. Either we go this way or that way, or we retreat. 3 different options will be centered here. Next we follow the lower contour. Again, you can walk on one side, you're like a specialist, you're going to take it like this, and you're going to walk through. Or you can walk to the center, cross to the other side and walk downtown. Let's do what's best for you first. We reach the center and the other side. Plugging into the center. Contouring, injecting the drug into the contour, usually takes somewhere around half of the drug. That's 0.5 on everything. In order to further introduce volume, we will work like this. We're going to work from the same point on the center. I mean, here we go to volume. Yeah, we're filling in the volume along this line right here in the middle. Also linearly we fill the volume. Same with the lower lip. Here it is the line that divides the lip into inner and outer lip. And we go exactly the same way, filling in linearly along it. So we have volume along this line, which divides the lip into inner and outer. If we have one, that's understandable, isn't it? Classic. If we have the task to make Angelina Jolie's lips, that is a dimple, here on top, then when we work on the volume, we will finish the injection of the drug here and here, so that there is a void in the center. Then the extra volume, I'm drawing here, which is clear, then the extra volume that we put in on the sides will be reinforced, and the place where there is no gel, it will fail. We'll leave the center. Yeah, and it creates a little Yanoka like this. There's no such thing that if it was all so beautiful, as they say, then everybody would come to us and say, give me Angelina Jolie lips. And they'd all come out with lips like Angelina Jolie's. Clearly, it's just the name and the meaning, right? If she wants some Janoshka, we can give it a try. We can't give a 100% guarantee that she'll have it exactly as she showed us in the picture, because she has her own lips, a person has different ones. We can just try harder. Let me not gel here and explain the point that there's a chance we could make it work. Because the gel can. Some have tight lips, some have soft lips. Who has soft lips, the gel will go inside. Those who have dense, on the contrary, will lie down well. So now let's look at these features some more. Angelina Jolie, okay. Same with the bottom one. If you want a lower cut, don't put volume in the center either. If the task is to lift the corners of your mouth, remember I laughed at this task. Not right. It's easier to lift the corners, but if there is such a task, it's not difficult for us, and we step back 5 millimeters upwards. We will inject the drug, so that it will be right here when eating. We lift the whole thing with our hands by 5 millimeters. Remember, we have 5 millimeters right here, and here we lift it upwards right here we will inject it and pull the drug back. We're administering the drug. And we're pulling it back. It goes right on top of our lip. Then we're going to fix it with our finger. So in this way there will be no obvious clown-like elevation, of course. That's all we can offer her and do. Try to increase it. And a clear recommendation of this girl to change her facial expression more often and walk not with such, but with a positive one. If there is, basically, a task to turn the upper lip, they often come in, can I turn this whole thing? I mean, let's say she's a narrow lip, and she wants a wide lip. So what can we do in this case? If you do a classic lip augmentation for this girl, and at the end you knead in such a way that the gel turns the lips, that is, you knead, it will be enough. But you can, again, twist it, go over the outline as usual. And it is not as usual, and we will go 1 to 2 millimeters higher than the contour of the lips. We'll go 1 or 2 millimeters higher. For example, he only wants the top one. The same would be true for the bottom, but usually only the top is wanted. 1 to 2 millimeters above the lip contour, follow the outline. And then, remember this technique where we lift the corners of the mouth. Yes, we inject over the lip. So it will be exactly the same here. In order to turn her straight out, yes, we will indent 5 millimeters and inject the drug in this way. This introduction does not cancel out the volume fill in the center of the lip. So you don't end up with a hole like that. Volume has to be everywhere. It's just that as she needs to deploy, you'll have a large amount of drug to do that action. Because you're going to enter it like this. And then knead with your hands, respectively, in such a way that it's all flattened like that. Kneading. It's all contouring. Kneading. Oh, here, by the way, is a move from a facial massage to eliminate the nasolabial contraction. You're gonna need it. If it's expression wrinkles, about contouring, kneading and contouring. We don't do Mesotherapy and biorevitalization. Now we've administered the drug. Let's say they introduced it to the entire zone. And then we're going to start kneading it. Remember, we have a technique in anti-aging facial massages. Massage when wrinkles are smoothed out. So, this is the same way we're going to spread the gel. It's a very strong pressing movement. You could just do a spot treatment. You can make circular motions, zigzag motions, with your thumb, with your index finger. The task is to spread the gel so that it lies flat. If it's the eyes, just like that, we put the gel in and then we spread it out. If it's a nasolabial fold, then in addition to the usual kneading movements where we take a glove or a tissue, well, it's kind of like that with gloves. With gloves we get through the open mouth to the inner surface. And we fix our fingers, big index finger, and knead the nasolabial area from the inner part, so that the gel is evenly distributed. If it's lips, the lips are only needed so that you have them fixed inside and out. That is, with a finger directly take the lip and knead, spread the gel on one side, on the other side. So, kneading is the most important part of the procedure. If suddenly, at first, you made a mistake somewhere you injected more drug, somewhere you injected less, somewhere you forgot something and got confused, yes, well, it is clear that in the process of kneading, there is a chance to fix everything. But also, at the same time, if you miss the kneading, forget it. It is a very high risk that the gel will not lie evenly, it will be ugly, may be asymmetry, there may be some lumps that everyone is afraid of. I mean, that's bad. Knead hard, well and long. The better you stretch, the happier the person will be. The kneading process is painful, so it can even be more painful than the procedure itself for some. But the better you stretch it, the better the results will be. There are even times when you've done it perfectly, start kneading, and some bruises appear. But it should be warned that this is a normal reaction. There could be bruising, hematomas. There are times that from kneading. So just pushing them from bruising to xylosenes. Any questions? I see. Recommendations are then written. Recommendations for Mesotherapy. If it's the politicians. Obligatory I cannot say, but it is highly desirable to combine with massages anticellulite, fat burning, lymphatic drainage. The word recommendation, after all. But I find the lipolytic insertion procedure pointless and massage-free. So there is some sense, something will certainly break down there, something will happen, but not in a way that it can in combination with massage. That's why I would say useless and pointless, because it's not, but so much cooler the result will be if done immediately after the massage. It's further understood that if she works in a policy driver and then eats potatoes for the night, there will be no results from anything. So a nutritional recommendation is mandatory. Increase physical activity. Three days in advance we start drinking aspartame if someone really wants it. As a general rule, drink or don't drink, there's not much difference. On the day of the procedure, it is best not to smoke or drink. Understandably, you don't even have to drink the day before. Aspartame strengthens the blood vessels to reduce bruising. If there are any drugs, medications, the medication should be finished 2 weeks in advance. I mean, take your meds, then come back. You don't need to mix anything with the drugs. None. We're discontinuing all medications. For a week after the procedure, exclude bath, sauna, solarium. Tanning after mesotherapy can lead to the development of age spots because the injection sites will make them aware of themselves. Baths and saunas will promote rapid excretion of the drug. We don't need that, we need him to stay. After the procedure, it is immediately recommended to do a lymphatic drainage massage the next day, with the purpose that if we have drainage preparations, therapeutic cocktails, if it is lipolytics, we do a lymphatic drainage massage the next day. Cocktail split, here it is fatty tissue breaks down, and the breakdown products need to be excreted. They can of course come out on their own, but ideally, immediately after mesotropia, you should have a lymphatic drainage massage the next day. Can this press use be served? Yeah, it's gonna be really good. If it's the face, then come in for a facial drainage massage to get it all drained out. What I said about alcohol, smoking, taking medical drugs, bathing, sauna, it all applies to all injectable methods of biorevitalization and contraplastic surgery including. Special indications for contouring, for example, would be that after the procedure you cannot kiss, that is, touch the area, but this isn't any, again, injectable techniques. Exclude contact with water on this day. No fried food, no hot food if it was our lips. On this day, don't. Something I'm talking about kissing, that you can kiss. Someone in my class said about oral sex. Can I have that? What do you think? It's okay to hold back. An epsilon. So, on the day of the procedure on themselves no creams, nothing, cosmetics do not apply, on the body also do not go to the shower, do not smear with anything, do not touch anything, so as not to get any infection. Because, after all, the injection method of skin damage, and some chance, risk is still there. Don't. Clearly, if she does, she won't die. And she'll probably be fine. But it's better to sound out that you don't have to do that. Further, after contouring, the recommendation is to keep the face at rest. That is to exclude facial expressions, some laughter, tears, obvious display of some emotions on the face. That is, the gel should lie flat, spread evenly, so do not touch it. And sleep on this day after contour placed strictly on the back to know there, only nasolabial lips made, already lying on the side and cheek cleaning, yes, why, so we sleep on the back. If bruises and hematomas appear, we smear with troxacitin, any other cream to remove bruises. If you really, really badly want them to go faster, we smear 5 to 6 times a day. That's a shame. I mean, just like a greasy layer. And if you're worried about bruises on your face, there's the option of wearing glasses. For example, it saves someone if she is afraid to walk down the street. And a bruise cream option with a foundation effect. It happens too. But again, if you ask me as a specialist, I advise that all hematomas, bruises go away on their own. Because it's the body's natural reaction. He puts all his energies there and is active in that area. So let him rebuild on his own. There's usually some redness after the procedure. For example, if the technique is popular. If it is mesotherapy, biorevitalization, papules in some women can persist for a long time. Up to 3 to 4 hours, for example, they are visible. That's normal. Some people have them right away, you can't see anything. It's out. Yeah, some people have a few days. So it's okay. Be warned that doing lymph drainage the next day will make everything dissolve faster. Here you go. Further, after contraplasty, also some bruises and dermatomka worn can be. And if something suddenly, all of a sudden, well, you're unlikely to have something, aren't you? But the way to get hyaluronic acid out is the drug hyaluronidase. Hyaluronidas. So this drug, it breaks down hyaluronic acid. If, God forbid, suddenly something, somewhere, I don't know, bad drug, and you have not needed anything, and the woman has such a peculiarity, all the stars aligned, and she has something there that needs to be urgently removed, then this drug removes everything. Hyaluronic acid breaks down. So, what about here? All the same, after injecting all these interventions, manipulations, the next day for the purpose of lymphatic drainage facial massage show, it turns out. And you can even get canned. Don't can it. We're going to use this one too. Manual only. Let's go get the drugs. What medications are needed? So the drugs, we've talked to you before, a huge number of drugs. If we have you living in Turkey, you may have your own there. We have our own. Somebody's suppliers are giving these drugs. Some don't have them, others do. Your job is to grasp the meaning. And maybe try. Tried it, liked it, and that was it, and took it. But you know yourself that experiments sometimes succeed, sometimes not so well. Johnny and I tried a new take on coffee today and we're not very happy about it. So experiments like this are at your own risk. Yes, usually the beautician chooses some line there, works with something, and already always knows completely how to be with it. Now we are going to analyze such basic things, basic elements, which in principle, well, I think, in any country, in any firm should be. Let's start with mesotherapy. Mesotherapy cocktails were originally invented. The word mesotherapy cocktail is coined to take several components and mix them together. That's what the word cocktail comes from, isn't it? But, as practice has shown, you teach people, you talk about it. No one does it because it's inconvenient. It takes a few ampoules, you open a half from here, a quarter from here, and you're left with extra. On another client, understandably, we won't use an open ampoule. And it's kind of embarrassing. It is easier to take a ready-made complex, where all the vitamins are already there. C, A, E, B, right. And you don't have to dilute them with procaine, which is the base, add all those ampoules in there. Don't. It is easier to take a complex. It will be cheaper in price and without any, excuse me, hemorrhoids. So, well, you should know that you can do that. If you really want to go deeper into this field, you can be a bartender there, stirring cocktails and doing things. Unfortunately or fortunately, I am not such a connoisseur of cocktails, especially since they are completely eliminated in 2 weeks. I do not see much point in these experiments. It is easier to take a ready-made than something to be afraid to mix the wrong consistency to take and somehow harm, so you just in case write down that procaine in basic. There are ampoules like this too. They're Latin, aren't they? Yes, you can rewrite it. Basic. How is that basic? The word is English. So it's the basics, it's the basic formulations that we need to take them as a base. So somewhere around half of your cocktail ends up or 1/3. It has to be that foundation. But it's not pure vitamins A, B, C. But you take the basic or procaine base, and then you add whatever you want to it. Make a note that this is the basis. And on it we add what you want. For the face, it could be hyaluronic acid. Remember we had a sign here and I showed you that it's like water in mesotherapy. So it could be a mesotherapy cocktail. It's 10 times there, or how much cheaper than biorevitalization, and naturally than contraplastic. So it's this kind of water, hyaluronic acid. And why wouldn't it just be made by a man? Here you go. Next, vitamins are injected into the face. A, C, E, B, D. Artichoke is often used. But more, of course, for his body. But you can do it for your face, too. Further to eliminate alopecia, for example. You can find some super compound on the internet and mix up a smoothie. And from the super composition, the action will be like this. A woman's hair will first fall out all of it, and then new hair will begin to grow. If we don't need this action, then I don't recommend this method of injecting cocktails into his head. I recommend taking a ready-made complex already, where without any special effects. It will simply be strengthening, vitaminizing and accelerating hair growth. And the usual cocktail that you mix yourself, keep in mind that there may be such an effect that first the hair will all fall out, then it will start to grow. Understandably, women don't need it. Here, respectively, for hair, for example, this vitamin complex we will do for hair. There is, so watch how you navigate everything I say, it's very simple. Take some kind of price from the firm that you came from, that you want to work from, or that you have nearby, or that you've made arrangements with, and you look. This is where they all have, for example, contraplastics, and look at what preparations they have. Biorevitalization, see what preparations are available. Next up is mesotherapy, for example. Here's mesotherapy, and looking at what? Control complex. And right away they almost all price lists go, the names, what goes in there and what effect it has. So you don't have to make anything up, you don't have to worry about anything. You look at the price. Clearly, it's a price cost thing. You add syringes, gloves, chlorhexidine, wipes, disposable caps, sheets to the cost price. And only then will you have the cost price. And from this cost price you set the price of the procedure. Usually cosmetologists multiply the cost price by 2. But, for example, as far as contouring plastic surgery is concerned, there they often multiply even more. So it's as simple as that. If you need any cocktail for vasoconstriction, that is exactly the same in this price list, or, for example, ask this company itself, I have a vasoconstrictor. I couldn't find what you have in your price list. They say, well, take this one, take this one. All right, for what it's worth, you take it. If you need a lymphatic drainage cocktail in there, see if there are any policies, if there are any anti-cellulite cocktails. Usually they're all labeled right off the bat. In Mesotherapy anti-cellulite, what we have again, so you know what ingredients go in there and what you can mix from. L-carnitine, for example. That, athletes even ingest that will. L-carnitine. L-carnitine. Everything I'm listing, make sure we dilute it. Oops, someone I have makes them in pure form, I know, but no one has died, but had a nasty reaction once to caffeine. I mean, it's like the skin is crusted over with some kind of red. It's better to dilute, especially such fat-burning anti-cellulite ingredients, it's for a reason. They're ready-made ones. Yes, they're ready-made ones. L-carnitine down, caffeine down. Caffeine, artichoke. Phosphatidylcholine. One word. Phosphatidylcholine. It also has anti-cellulite properties. The off-the-shelf ones that we take, for example, it's mesostable. It's inexpensive and it's the most workable. We've tested it a bunch of times, and a bunch of times it really shows itself to be the best. That is, the results are amplified. The results are good. It's such an old drug. Everyone has been using it for a long time. Understandably, there are new firms coming out every day. You can try things, or you can use something tried and tested. PHDC, it's called. Also an off-the-shelf component. Anti-cellulite. Already inciting. You and I are going to make it for the people. PHDC Forte. Also a little stronger than the regular PHBC. So for hair, well, again, complexer vitamin C can be done. To eliminate vascular asterisks and against varicose veins, as I showed you, along the vein rows at the pope, but pass along the vascular rows, vitamin C to strengthen the blood vessels. Nicotinic acid. Now, yes, but keep in mind that it's nicotinic acid, people can be allergic to it. There's a ready-made facility for everything, and you wouldn't have to make one. Next up is biorevitalization. What biorevitalization products do we have available? You and I will look at the ALP system as well. This is it, isn't it? The oldest drug. He's been on the market for a long time. That's where everyone started. And he still is, That's when people ask me what's the best drug, right? If I'm talking to a client, it's like one conversation realizes he doesn't know anything at all. And when, for example, in training, you ask me which drug is better, I will tell you that we have that scheme where we have molecular densities of 6 to 16, 16 to 28, and 28 to 36. So this is the key point: density. What's the name of the drug? What kind of gold particles or embryo cells or LEM cells they put in there, or that he is from Italy or France, or that his price there is not 5,000, but 25,000. These are all kind of marketing moves, which in principle have no effect on the result. We care about density. We have the task of moisturizing hyaluronic acid. She can't be any different. She could be. Something's been added to it and named differently, right? But the principle of it in hyaluronic acid itself will be fulfilled in any case. With any preparation, we will get moisturization and smoothing of fine lines and wrinkles. Any drug will cause your own hyaluronic acid to be produced. Any drug, if we're talking about contouring, there are more differences, some stiffer, some softer. It's a little more serious than that. We'll get to them in a minute. But basically, new drugs are coming out every day. We have to come up with something for these poor companies to entice petitions to tell them that their product is so much better. To buy it. So you can try it. You can go to seminars there where they give it for free, or you can buy it at cost price on somebody. Try it, yeah. Well, I'm talking about proven methods, so you don't say, oh, what did I do? If you work with these drugs, you will not have any drugs to me personally. I mean, if you try something yourself, well, try it, sure. I'm all for trying new things, yes, always. Here, Heal's system and Yale's system asp. There's the tsa, is stronger. And it is usually only used for grandmothers, only for age-appropriate clientele, and only in the very last stages. That is, when we went 0.6, 1.1, did a couple times, and already there we moved to a stronger, densest asp. The Princess range is doing well. Did you hear that? It shows well. Her longtime clients have known her for a long time, too. It's rare for someone who is an active user of something new. So there were no accidents. I mean, if you go on the internet, it's all positive stuff. So, princesses is divided into. Write it down. Princesses. It's a bit long. So it comes in 3 varieties. 3 kinds. Rich, balm. And filler. So Princess Rich is a biorevitalizant. That is, you can do biorevitalization all over the face with it. Princess Rich is a biorevitalizant. Princess Filler is a contouring treatment. So we fill in wrinkles, nasolabial wrinkles, deep wrinkles on the forehead, around the eyes. And if we need to moisturize our lips without adding volume. I don't want to add volume, I just want to moisturize them. Then we'll use a filler. Princess Filler for moisturizing. And if we want to increase the volume of our lips, we take Princess Volume. Why else is Princess so popular? Because it's simple. Here I've explained to you in 1 minute the entire classification of drugs. And there's no need to make up anything and measure it somehow. It's as simple as that. This is a biorevitalization and this is a filler. It fills in all the wrinkles. If you need lip augmentation, this is the balm. It's all blood. The most basic thing. And it tends to be soft. If all of a sudden your hand puts something in the wrong place, it's soft, it lays down gently, and it's easy to correct. Let's put Sujderm on the list, also a popular line of Sujderm. Okay, I guess I'll give it a shot now. I may have been the one who made a mistake on that word. So there's 18, there's 24. 24. Where to? Well, I think so. Yeah. That's right. So 18, 24, 3, 30, 30 expert. 18 we have it closer to biorevitalization. Yes. But the biorevitalization there is 16. That's why it's denser after all. And you can't use it as a biorevitalization treatment. It's solely contouring. So with such a small molecular volume, what do we do? The small ones. Fine lines, such as around the eyes, yes, goosefoot. I mean, an eye's tighter than 18, I wouldn't do anything. So there's a possibility that there will be contouring, i.e. the drug protrudes under the skin. "30 XP immediately. We're the ones with the lips. Increased volumes. XP. Now that's an attachment. Means the drug is mild. Accordingly, if we compare it to the Jujiter 30, the 30 is solid. And you'll have a clear outline. If you have entered somewhere wrong, that outline will be visible. And it may even be that you can't stretch it. That's why 30 is now long gone and no one uses it anymore. You may want, if very much, to take it, for example, in order that some. I so want my lips to have that clear contour. Then for just such an occasion, I recommend taking a Storybook 30. Only for a clear lip contour. Your contour will be straight up so thick gel, it's stiff. And 30 XP is soft. That is, you will be able to stretch it out and put it down as you need it. And accordingly 24 we have nasolabial wrinkles, forehead wrinkles, interbrow wrinkles. There's a drug, for example, Juvederm. The Juvederm lineup is also divided as well. There's a little more of it. And there's even a drug called Juvederm Smile. So it's specifically for lip augmentation. If you go online about princesses, Princess Alum is also considered lip only. What's the difference? By the way, this is important. Juvederm because it's very popular and expensive. And it's often made profitable for cosmetologists, too, to make it. But it's got lidocaine in it. And we know people can be allergic to lidocaine, and it's a serious allergy. So before you make one, always read what is included in the ingredients. There shouldn't be any lidocaine. In anesthetics like Emla, yes, Emla has lidocaine in it too. So whoever is allergic, either choose another method or don't do it at all. Somebody does. I know, but do it this way. Well, not something I can do, yes. I mean, on lidocaine, be careful. Basically, it's fine. Narrative, too. So, do you have any questions here? Yes, I do. It's clear. Good. Scheme of introduction of mesotherapy and biorevitalization. Mesotherapy is administered generally to vitaminize the skin, so we will distribute it evenly. If the task is to remove cowpris, then we will work with cowpris. If the goal is to reduce varicose veins, we will work around the veins. So, the first thing we do, for example, we do facial mesotherapy. We distribute the papules evenly, spacing them 3 to 4 centimeters apart in a staggered pattern. All over my face. If there is a need to work on the neck, inject the mesotherapy cocktail into the neck, décolletage area. Again, we will not notice any obvious rejuvenating properties. Facial mesotherapy is done for the purpose of vitaminization. If we have some kind of vascular network, for example, around the nose we often have cowporosis, on the cheeks, we inject papules. Around these nets. And there's about 5 to 7 millimeters between the papules. If there are veins on the legs, accordingly, exactly the same. 5 to 10 millimeters between the papules. And along each vein, we inject the drug. It's usually vitamin C or some kind of vasoconstrictor cocktail ready-made already. If we inject Mesotherapy into fatty positions, we clamp the skin fold, take as much as possible, and inject the drug perpendicularly at a distance of about 3 to 5 centimeters. Stakes are made 3 to 5 centimeters, only in localized fat deposits. In some areas where there is no fat, inject mesotherapy is not necessary and cannot. The same goes for the second chin, where we grasp the fat fold and inject the drug there perpendicularly. So on the second chin, by the way, there's my introduction technique. It is somewhat more effective than the regular one. Let's imagine that this is the chin, and here we have the person lying down. We will work on the second chin area in a papular, even manner. The distance between injections will be somewhere around 1.5 to 2 centimeters. And then the amount of drug that we took on the area of the second chin, for example, 1 milliliter. We went papular on the entire surface of the second chin. And then they clamp the fat fold further. If we've had papules, we've had papular technique, the next will attack. Whatever is left, the amount of drug, we inject perpendicularly into the fat fold. So we take the center one and we take, for example, the side and the side. And so we inject all of the remaining drug into the fatty tissue in the chin area. Biorevitalization. The same is done if we have a goal, for example, to moisturize the entire skin of the face and neck and décolleté zone. Then, first, we need to calculate the amount of the drug. If we work all over the face, it will take one amount of product. If we are using the neck and décolletage area, we will need a second 1.1 syringe. So you get 1.1 on the face of it. Neck and décolletage also 1.1. In this case, if we are evenly distributed, the introduction of papules will be the same as in mesotropia. So the spacing will be somewhere around 1 to 3 centimeters staggered. But if the preparation is not enough, for example 0.6, and the task is only to remove goose feet, then 0.6 of the preparation may well be enough only for goose feet. And if there's something left over, we can finish it off in an area that we agree on in advance with the client. like finishing the neckline, what's left of it. It happens that we work, for example, with hound's feet. We agree that the rest of the preparation will be evenly distributed on the face. There could be such a scenario. If we are working on the hands, biorevitalization is done to eliminate fine lines and wrinkles on the hands. As women age, the skin becomes so dry, fine lines and wrinkles appear, and biorevitalization is indicated for such aged women, and do it exactly the same way. Spread 1.5 to 2 centimeters on the hands from above under the skin papillary.